Welcome back to my clinic.
Thank you for having me.
How are you, Katharina?
I'm so good. How are you?
I'm more than happy to see you today, so what brings you in?
So, unfortunately, I fell in the shower and I bumped my head.
Okay.
And I really hurt myself. My back has been killing me since.
Where particularly did you hit your head?
Right here.
Right here?
Yeah, and it hurts.
Is it sore to the touch right now?
Yes.
Okay. So you bumped your head?
Yeah.
Anything else?
My back just hurts so much. There's a lot of tension in my lower back right now, and even if I go like this, I'm in pain.
I'm so sorry to hear that. And when did this happen, Katharina?
Yesterday.
Okay. And have you been in constant pain ever since, or has the pain subsided in any way?
I've been in constant pain. That's why I'm so glad that you had time to fit me in.
Constant pain. And have you taken any medication for it?
I'm on a pretty high dose of ibuprofen right now.
Do you know how many milligrams you're taking?
Well, it's 250, but I'm taking 4.
250 times 4. Okay, so that's 1,000 milligrams every how many hours?
2.5.
That's a lot. Okay. So I'm more than happy to give you a cranial nerve exam today to make sure that you've not damaged any of the major 12 cranial nerves during the fall, as well as take a look at your lower back, perform a back exam, and see if I can relieve some of that pain.
Okay, I really appreciate you.
Sounds good? Alright, so let me just make sure that I have your chart up to date. Do you have any new allergies that I'm not aware of?
I just have pollen.
Pollen. Okay, I did not have that in my chart, so I'm happy that I caught that. How about any blurred vision or double vision? Have you had that?
No.
Okay. Any difficulty breathing?
No.
Alright. Any tingling sensations in your arms, your legs, your face?
No.
Okay. So let's go ahead and begin the exam. I'll put my chart right here and put on the gloves. Now I'm going to ask you just a couple of questions to assess your mental acuity. Do you know where you are today?
Yes, I am in the doctor's office.
Okay, do you know my name?
Is it Luna Lux?
That's right. And do you know who the President of the United States is?
Joe Biden.
Very good. So I'm going to start off by taking your vital signs. And on a scale of 1 to 10, how would you rate your pain today?
We're definitely at an 8.
An 8. Okay. So that's a lot. Okay, I'm going to start off by just listening to your heart and your lungs. This is going to be a little bit cold. Is it okay if I put it under your shirt?
Yes.
Okay, so just breathe normally. Just going to listen to your heart. Not hearing any murmurs or crackling sound. Good steady beat. And a steady rhythm, not hyperdynamic. I'm going to listen with the bell side as well. I'm hearing S1 and S2, not hearing S3 and S4. Wonderful. Okay, I'm going to listen to your lungs next. Take a deep breath in for me. And out. And deep breath in and out. Wonderful. Is it okay if I listen in the back as well?
Of course.
Okay. Take a deep breath in for me and out. In and out. In and out. Okay, that's wonderful. So both the front of your lungs as well as the back. I'm not able to hear any abnormal sounds whatsoever, so the base of your lungs sounds clear, which is wonderful. I'm going to take your blood pressure and your temperature next. Just relax. 98.5, so you do not have a fever. Do you know when the last time you had any flu-like symptoms was?
Well, like 6 months ago.
6 months ago, okay. Wonderful. Do you have an arm preference? Okay, we can do the right one. And when is it the last time that you had your blood pressure taken?
About 6 months ago, yeah.
6 months ago, okay. Do you remember what it was?
I think it was 180. Sorry, no. Sorry, 120 over 80.
Okay, so normal blood pressure. That's wonderful. Okay, make sure you uncross your legs from here. Yeah, very good. And you can just squeeze your arm over here in between mine. And just relax for me. (120/60). Wonderful. And we can just squeeze the cuff out slowly. Okay. Let's check your levels of oxygenation as well. And I'll need your index finger. Just relax for me. 5, 4, 3, 2, 1. 99% oxygenation at room temperature and 77 beats per minute. So your heart is very relaxed, not overworking. I'm going to perform a cranial inspection first. Is it okay if I come close and touch your head? I'm looking for overall cranial symmetry, lumps, or bumps. Not feeling any lumps or bumps in the back of your head. You said you bumped your head right here.
Mm-hmm.
Do you have pain when I apply pressure?
A little bit, yeah.
On a scale of 1 to 10?
3.
3. Any pain right here in the back of your head?
No.
Okay, pressing down at the top of your spine. Not feeling any lumps or bumps. Just checking your lymph nodes for any potential enlargement. Not noting any. I'm going to try to move your head to your right. Don't let me do that. Very good. Now towards your left. Don't let me do that. I'm going to try to push your head back. Don't let me do that. All right. Can you clench your jaw for me? Excellent. Unclench. Can you puff your cheeks out? Don't let me unpuff them. Very good. Now raise your eyebrows for me. Wide, 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 high. Very good. Going to attempt to lower them. Don't let me do that. Excellent. Now close your eyes. Keep them really tight. I'm going to try to open them. Excellent. Now can you please push your tongue in your right cheek? Very good. And now into your left cheek. Excellent. And stick your tongue out for me and move it left to right and then up and down. Excellent. So I'm going to take a couple of measurements of your head. I'll start with the circumference of the head and then a couple of measurements of your face. Just relax for me. So your face is very symmetric. I'm not able to notice any droopiness. Just by looking at you, your pupils are round, normal size and shape at room light. I'm going to go ahead and check the nerves in your face. Can you please close your eyes and tell me where I'm touching you?
Left cheek.
Very good. How about now?
Right cheek. Sharp. Dull.
And where am I touching you right now?
Right cheek. Forehead. Left cheek.
Excellent. Can you tell me if you feel this?
Yes, on the forehead. Yes, on the chin.
Good. So you have good sensitivity to cold. And can you please tell me if you feel this equally on both sides of your forehead?
I do.
V1 is clear, equally on both sides of your cheeks.
I do.
V2 is clear. How about this?
I do.
V3 is clear. Excellent. Now I'm going to touch you to different textures. Can I please have your palm? Okay, so this is sharp and this other one is dull. Close your eyes and let's see if you can tell which one I'm touching you with.
Dull. Sharp. Dull. Sharp. Dull. Dull.
Excellent. I'm going to check your eyes and your vision. Can you please look right here? I'm going to assess the response of your pupils to my light. So pupils are round and reactive to light. They contract and dilate in the normal amount, in a normal rate. Let me try to measure them. So look right here. And let's see the size of your pupils. They're about 3 millimeters, which is perfectly normal. Now I'm going to assess the mobility of your eyes. So look right here first. Now look at my light right here. Try to keep your head steady. Look again right here. Look at the light, my nose, and now just follow the light with your eyes. Right here. Any double vision right here?
No.
How about right here?
No.
Okay, continue following the light. So your binocular vision looks intact. Excellent. Now I'd like you to mirror me and touch your nose. And now continue looking into my eyes and touch my finger with your nose and then touch your nose again. Nose, my finger to your 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 nose again. Excellent. Can you please cover one eye for me and tell me when you see my fingers entering your field of vision?
No.
Excellent.
No.
Excellent.
No.
Excellent. Now let's repeat the same test over on the other eye. Tell me when you see my fingers entering your field of vision.
No.
Excellent.
No.
Perfect.
No.
Excellent. And now look right here and tell me when you see my fingers escaping your field of vision.
No. No.
Very good. And finally, I'm going to do an ocular pressure test to assess the state of your ocular nerve, just in case that might have been damaged in any way during the fall. I'm able to visualize your cornea with my ophthalmoscope here and your optic nerve. So if there was any damage during the fall, I'm able to see it. All right, Katrina, so look right there for me and just relax. I'm going to come really close and shine my light in your eye. Can you please look up for me and down to your right and to your left. Excellent. So I'm not seeing any scratches on your cornea. It looks intact. Optic nerve looks healthy. There are no popped vessels, blood vessels in your eye. I'm going to repeat the same test over on the other one. All right, Catherine, now continue looking in the distance for me. And going to take a look at the optic disc, which looks intact. Can you please look up for me? And now down to your right and now to your left. Optic nerve looks intact. Not seeing anything of concern with your eyes. All right, Catherine, now so I'm not seeing anything concerning with the cranial nerves that control the muscles of your face and your eyes. I'm going to focus on your ears, nose, and mouth next.
Okay.
Have you heard any abnormal sounds, tinnitus, ringing in your ears after the fall?
A little bit of tinnitus.
A little bit of tinnitus. Did you always have that, or was it new?
It's new.
New, okay. And it starts right after you had the accident?
Yeah.
All right, so let's check out your ears. Just relax for me and you can close your eyes. Not feeling any lumps or bumps. Do you feel any pain when I pull your ears back?
No.
Okay. Alright, I'm going to just take a look at them with my light from the outside. Not seeing anything abnormal, no external discharge of any fluid, no redness. Let me take a look at this one as well. No redness, no external discharge, normal ear auricle. Right, let me take a look inside your ears. I have here an otoscope, and this is going to allow me to visualize your eardrum. So just look to your left and just relax for me. Normal tympanic membrane, pearly gray color. Not seeing any evidence of any cerebral spine fluid dripping in your inner ear, which is very good. And no signs of any inflammation. Let me take a look on this ear as well. I'm able to visualize your ear canal and eardrum. Pearly gray color, well-defined margins, and no evidence of any cerebral spine fluid dripping in your inner ear, which is very good.
That is good.
Alright, Katharina, so the inside of your ears look perfectly healthy. I'm gonna go ahead and perform a quick hearing test. So close your eyes and tell me which ear do you hear this sound with, left or right?
Right. Left.
Excellent. And can you please tell me when you stop hearing this sound?
No.
Excellent.
No.
And how about now?
No. No.
Excellent. I'm gonna go ahead and whisper some words in your ear. Close your eyes and repeat them back to me. Tingles.
Tingles.
Sky.
Sky.
Watermelon.
Watermelon.
Summertime. Fun.
Summertime. Sun.
Excellent. Next up, just to make sure that your hearing is perfectly okay, I'm going to use a tuning fork to test some of the more sensitive, high-pitched vibrational sounds.
Okay.
And make sure that your ear is sensitive to them. So close your eyes and tell me if this sound is louder or this second one.
Number 2 is definitely louder.
Number 2, excellent. Okay, let's repeat the same test over on your other ear. So is this louder?
Number 2.
Number 2, excellent. Okay, Katharina, next up I'm going to focus on your nose and your mouth.
Okay.
Have you noticed anything abnormal with your sense of smell or taste?
No.
No? Okay. So I'm going to just take a look inside your mouth. Can you please open wide for me? Okay, the back of your throat is not inflamed. Teeth are intact. No cankers or sores. And a pinkish healthy color for your tongue. I'm going to take a nose swab and a mouth swab. Is that okay?
Yeah.
Okay. We like to do this with everybody that comes to the clinic, just to make sure that there are no infections or, you know, viral or bacterial infections that we should treat.
Okay.
Look up for me. This is going to be just a little bit ticklish. And the other one as well. So that's one sample. And now I'm going to do the same from your cheeks. That's one and that's two. Excellent. So I'm going to send this into our lab that's right here in the clinic, and we'll get the results in about 24 hours.
Awesome.
All right, next up I'm going to test your sense of taste. I have here an essence that I'd like you to identify. And one drop on the tip of your tongue.
Soy sauce?
Soy sauce, excellent. So that's very salty. And I have here another essence, slightly different. This one is a little bit harder to identify, so don't be concerned if you can't get it right.
Is this vodka?
Vodka, yes, very good. Wow, okay, that's very good. Not many people get that one right. And finally, I'm going to test your sense of smell.
Okay.
So let's see if you can identify what this is.
Oh, cinnamon?
Cinnamon, very good. And finally, something a little bit more different on the spectrum of smells.
It smells like an herb.
An herb? Can you tell what herb that is?
No.
Basil. That's
Oh.
okay, it's a little bit hard. But it looks like everything is okay with all 5 of your senses. So let's go ahead and take a look at your back. And see if I can, you know, perform some adjustments, a little bit of a massage, and give you some relief today.
Thank you.
Okay, can you please put on your gown?
Definitely.
Excellent. All right, Catherine, now just relax. Just going to take a look at your back first and do just a visual inspection. And did you mention that the pain is mostly localized around your lumbar area in the back? Right here?
Yeah.
Okay, let me just make sure that there are no lesions or bruises that I'm missing. Your back has a normal temperature, no excessive sweating. Not seeing any bruising. I'm going to go ahead and listen to your back. Take a deep breath in and out. And one more time, inhale. Hold it. 3, 2, 1, exhale. Excellent. Not hearing anything abnormal. I'm gonna go ahead and palpate your back. Starting from the cervical spine. Can you lower your head for me? Do you have any pain in your cervical spine right here?
No.
Okay. Moving down towards your thoracic and lumbar spine. Any pain right here?
No.
Any pain right here?
No.
I'm not seeing any spinal abnormalities. Just going to feel your vertebrae one more time. Make sure that they are aligned and that I'm not missing any nodules. That feels very normal. Feeling a little bit of tension right here. Going to put some pressure, apply pressure. Just take a deep breath in and release. Deep breath in and release. Deep breath in and release. It's definitely a lot of tension right here. Perfect. I'm going to do light acupressure next and press down on pressure points that will help release endorphins and dopamine into your system to relieve some of the stress, relax the muscles, and make you happy. Going to move a roller up and down your back. This may feel a little cold, but it's gonna feel really, really good. Just relax for me. And around your shoulder blades. And the right one. Then your lower back as well. Up and down, avoiding the spine. going to warm up in a second. The rollers are pretty cold, but it does relax your muscles, so it is what your back needs. Just take a deep breath in and out. Just going to sanitize your back. Alright, Catherine, I can get dressed now and we can discuss the results.
Thank you.
Alright, Katerina, so I did a very thorough examination of your cranial nerves, your back. I performed some adjustments and a massage. Do you feel any better?
I feel so much better. Thank you so much. That was so relaxing.
Excellent. So the good news is that I'm not able to find anything abnormal with you. Your spine looks straight. Your back looks okay from a physiological perspective. Most likely the pain that you're feeling is muscular. So it will subside over time. Just try to rest. Don't work out. Don't lift any heavy objects. Just take it easy for the next couple of days and you should be feeling better.
I will definitely do that. Thank you so much.
Very nice seeing you. Thank you so much for allowing me to do this examination on you, and I hope to see you again soon.
I hope to see you again soon too. Thank you.